Many of the instruments used for orthodontic treatment are unique to the discipline of orthodontics. Knowledge of these instruments and their uses is important for all dental students before commencing orthodontic treatment on patients. What follows is an introduction and brief description of some of the more commonly used instruments for treating an orthodontic patient. A dental mirror, while not specific to orthodontics, is used for visualization and retraction during procedures. A straight probe aids in the positioning of orthodontic brackets and is used in the removal of excess composite from around brackets, as well as for the removal of elastomeric ligatures from brackets. Cotton pliers are used for the placement of cotton rolls for isolation, as well as for the retrieval of small objects intraorally. How utility pliers have two long beaks with pads at the ends that are used to hold arch wires during placement and removal. A wire cutter, or pin and ligature cutter, has two tapered beaks with sharp cutting terminal ends. The tip of the sharp end is used for cutting small diameter wires, less than 0.015 inches, and for cutting stainless steel ligatures. Distal end cutters have two cutting surfaces at right angles to the long axis of the instrument. These are used for intraoral cutting of the terminal end of a ligated arch wire. They will also catch and hold the cut end of the arch wire, thus preventing the loose end of the wire from injuring the patient. The Matthew plier has a quick-release locking and unlocking mechanism, which is used for the placement of elastomeric ligatures. The bird beak, or 139 plier, has pyramidal and conical beaks used for making bends in orthodontic wires. Separating pliers are reverse action pliers with tips at the end to hold the separating modules. Separators are placed on the ends of the pliers, and the handles are then squeezed together to stretch the separators for placement on the teeth. A band pusher is a long-handled instrument with an angled rectangular serrated tip, which is used for fitting and positioning an orthodontic band on a tooth. A band burnisher is similar in appearance to the band pusher, except that the working end is flatter. This is used to adapt and contour an orthodontic band to fit the patient's tooth. A bite stick is a long-handled nylon instrument with a serrated tip, which can be of various shapes. This is used for placing and seating orthodontic bands using the patient's biting force. The working end of the posterior band remover has a nylon-tipped beak and a flat beak, which has a slight curve at the tip. This is used for the removal of orthodontic bands on posterior teeth. The plastic filling instrument is used to place composite onto the mesh pad of an orthodontic bracket prior to the bonding of the bracket. A bracket holder, or bracket tweezer, is a reverse action instrument with two fine angled tips used to hold and place orthodontic brackets. A cheek retractor is used to move the cheeks away from the teeth to allow for visualization and isolation of the treatment area. It is important to know the instruments necessary for each procedure to ensure that you have a complete set prior to the arrival of the patient. The instruments required for the placement of elastic separators includes a mirror, a probe, cotton pliers, separating pliers, floss, elastic separators, and an air-water syringe tip. The instruments required for band seating includes a mirror, a probe, cotton pliers, an air-water syringe tip, a saliva ejector, a few appropriately sized bands, a band pusher, a bite stick, a band remover, a mixing spatula, glass ionomer mixing cement, a slow-speed handpiece, pumice, and cotton rolls. The instruments required for bonding brackets includes a mirror, a probe, cotton pliers, an air-water syringe tip, a saliva ejector, high-volume suction, a slow-speed handpiece, pumice, a bracket holder, brackets, a Howe plier, a distal end cutter, a ligature cutter, a cheek retractor, cotton rolls, etch and bond, and composite material. You will need to request an adjustment kit as well. When picking up instrument trays in the clinics, ensure that all instruments are included in the tray and that you have obtained any necessary additional kits. You will also need to ensure that the planned procedure or procedures are entered into Axiom at the previous visit so that the dispensary is able to prepare in advance for the clinic session.